אנחנו מזריקים בחיסון תערובת של חומרים, שהיא בעצם די לא סימפטית. יש שם קודם כל חלבון זר של חיידק או נגיף שייצרו בהנדסה גנטית, אבל מסביב יש סדרה שלמה של חומרים, כימיקלים שונים, שחלקם הגדול מוגדרים כחומרים רעילים, מסוכנים, אפילו מסרטנים בחלקם.
פורמלין, אלומיניום, כספית, אצטון, פנול, חומרים משמרים, כל אלו נמצאים בנוזל החיסון. תופעות הלוואי שמייצרים מרכיבי החיסון יכולות להיות קלות כמו חום גבוה ואלרגיה, ועד להפרעות נוירולוגיות קשות. רוב החומרים הללו מוכרים גם כחומרים מסרטנים. כשהקוקטייל הזה חודר פעם אחר פעם לגופו של עולל בן פחות משנה, הסכנה פשוט כתובה על הקיר.
יש מאמרים רבים על כך שמעידים שמהחיסון הזה ומהזרקה של אותם חומרים, שוב שהסברנו שהם חומרים משמרים וחומרים מייצבים וחומרים אנטיביוטיים וחלבונים זרים, שהם עלולים לעורר מחלות רדומות אצל הילד.
Well, when I was in medical school, we were taught that the body has something called the blood-brain barrier. The blood-brain barrier is like Fort Knox to the brain. Elements of the bloodstream cannot get into the brain, and those elements include drugs, viruses, and bacteria, among other things that are in the blood. Drug companies were very concerned about being able to develop drugs to get the drugs into the brain. And so they used something called a nanoparticle. Nanoparticle, very small particle, bound to the drug. And they found that if they could put a nanoparticle onto a drug, they could get that drug to go into the brain. And it shows in animal studies that they were able to do this. They then were able to take an emulsifier, which is something that's good with water and fat. It can dissolve in both. And if they added the emulsifier to the nanoparticle bound to the drug, they could increase drug entry into the brain 20-fold. This is right out of animal studies that I've found. So you have a drug, you have a nanoparticle, and you have this emulsifier. The vaccines are constructed the same way. You have the vaccine viruses and bacteria that are bound to a nanoparticle called aluminum. And that aluminum is a nanoparticle. And by definition, a nanoparticle has the potential to enter the brain. Most vaccines also contain polysorbate 80 or sorbitol. Both of those compounds are emulsifiers. Emulsifiers bind very tightly to the nanoparticle aluminum, which is bound very tightly to the vaccine antigens. This raises a question. If the vaccine model is the same model as the model that the drug companies are using to enhance the delivery of drugs into the brain, is it possible that vaccine ingredients are making their way into the brain of our children?
Chris, I wanted to come and see you to speak about your research on aluminum toxicity in Alzheimer problem, in vaccine and in other fields you are working. Mm-hmm. What are now your special research, your results? Where are you now?
Yeah, well, as you know, myself and my group, we've been working in the field of aluminium for more than 30 years now. And that covers a wide range. It covers from the basic chemistry of aluminium and through to the way in which it would interact with any living organism. And that has been our remit for 30 years, which is to understand why aluminium has no biological function. So that's really been what my group set out to do. Most recently, I would say in the last 10 years, our focus has been on what we call human exposure to aluminium. One of the things that my group has always said, we are not anti-aluminium. We absolutely respect the many ways in which aluminium has contributed positively to all of our lives. This is not an issue with us. We're not anti-aluminium. But whenever you introduce something into life and into, particularly something which is going to be you expose humans to, you would normally make sure that it's safe first. That would be the first thing you do. In fact, for almost everything else you can think of, you have to do that. You have to demonstrate that something is safe first. That has never been necessary for aluminium. It has never been demonstrated that aluminium is safe. No, there's never been any legislation in order to do that. And this is a historical thing. And actually, opposite to that, really covering up the damage that we probably know that it does already. For example, in the recent EMA, European Medicines Agency review of the HPV vaccine, how many experts on aluminium did they consult? None. So how can they get that aspect if they can not consulted anybody? And this happens all of the time, all of the time. We get people who have no knowledge, who are uninformed, sitting on World Health Organization, Food and Drugs, etc. All of these different committees who talk about aluminium. You have this fallacy of, I think it's the World Health Organization, giving a safe limit for aluminium. And they say, as long as it's below 1 milligram per kilogram body weight per day, you're safe. So I ask them, how do you know that when I don't know it? I've been working on aluminium for 30 odd years, trying to understand it. You know this. I asked them for the details. How did you work this out? And who did it? And it's based upon 2 or 3 animal studies taken from the literature. And that's a human recommendation. And the people who reviewed it, none of whom have any expertise in aluminium, and that has become a value that all over the world, people say, the World Health Organization. You know, the one thing I hope is this. I actually, like all of us, rely on people like the World Health Organization. I hope that in everything else other than aluminium, they do consult experts, and they are correct. So when they're telling us about, the levels of certain PCBs or something in the environment, I hope that they're not as wrong as they are with aluminium. Because if they are, then this organization is totally corrupt and useless. But in terms of aluminium, it is. And it always will be until they decide to actually talk to people who know.
J'ai regardé avec la plus extrême attention tous les travaux antérieurs à l'avènement de la myofasciite à macrophage sur ce qu'on savait ou ce qu'on croyait savoir sur les adjuvants alimentaires. Tout est faux. Tout est faux. L'étude qui fait référence actuellement sur ce que devient l'aluminium vaccinal une fois qu'il est injecté est une étude de 1997 menée par un chercheur américain qui s'appelle Florent, avec un autre chercheur qui est le pape des adjuvants qui s'appelle Stanley Hem. Ce travail a consisté à injecter un aluminium isotopique, donc radioactif, à 2 lapins, donc seulement 2 lapins, qui ont été injectés par voie intramusculaire et pour lequel on a suivi le devenir de cet aluminium radioactif dans l'organisme du lapin et on a regardé ce qui était éliminé dans les urines du lapin. Le résultat, qui devrait en soi déjà être un résultat extraordinairement inquiétant, est que l'élimination à 28 jours était de 6%. C'est-à-dire que 94% de l'aluminium était resté dans l'animal. Et on continue malgré ça, à dire l'aluminium est éliminé en quelques semaines après son injection chez l'homme. Plus grave, ce travail a perdu, entre guillemets, les os des animaux. Et on sait que l'os, c'est un des endroits où se stocke de façon durable l'aluminium dans l'organisme. Donc non seulement il n'y a que 2 lapins, mais en plus, dans les organes qui sont utilisés, les 2 fémurs ont été égarés, ont été malencontreusement détruits. C'est bête. Le muscle injecté n'a pas été examiné, c'est-à-dire qu'ils n'ont pas pu décider si l'aluminium qu'ils avaient injecté était resté sur place ou pas. Et donc, on se retrouve avec une étude qui s'arrête en plus à 28 jours. Alors que maintenant, il est absolument certain que l'adjuvant, il va rester pendant des années dans l'organisme. Et que cette étude qui dit « circuler, il n'y a rien à voir, regardez, il y en a très peu qui rentrent dans le cerveau », il y en a très peu qui rentrent dans le cerveau à 28 jours. Mais personne n'a regardé à 6 mois, à 1 an, à 1 an et demi après l'injection. Donc, c'est cette étude-là qui reste la référence de la vaccinologie mondiale. 2 lapins avec des organes perdus et avec un temps d'étude de 28 jours. Donc ça, c'est simplement, il faut tout refaire.
Again, we have a vaccine that contains massive doses of aluminum, which is a known neurotoxin. In this next segment, Dr. Paul Thomas, who's a board-certified pediatrician, runs through the calculation of exactly how much aluminum a newborn baby is getting in the hepatitis B vaccine.
It is vital that we start looking at the aluminum content of vaccines the same way we did for mercury, thimerosal, because we are far exceeding the safe doses. Just use the newborn hepatitis B dose as an example. It has 250 micrograms of aluminum. And remember, we're not supposed to exceed 5 micrograms per kilogram. Well, what does a baby weigh? At the most 5 kilos. I mean, that's an 11-pound baby practically. So 5 times 5, a 5-kilo baby, don't exceed 5 micrograms per kilogram. 25 micrograms of aluminum is what is supposedly the safe limit. With any toxin we've learned, like we did with lead, there's no safe dose, right? But even if you go with that dose, we know if you exceed that, it's not safe. And we're injecting 250 micrograms, 10 times the possibly safe dose, known toxin injected into every baby born in America. This is what bugged me since 2001, when they moved that Hep B to newborns and nobody cared. Nobody made a fuss. Nobody looked into it. It was like, all right, we got a problem. And it's just, the magnitude of the problem is just growing.
Okay, would you please rise and be sworn? Do you swear to tell the whole truth and nothing but the truth, so help you God?
I do.
Thank you. Seated. We're talking about why they're putting mercury in vaccinations and why it's never been tested since 1929 when Lilly developed it. Mr. Egan, has thimerosal ever been tested by our health agencies?
It's been only there were those early tests that you know of that were done by Lilly.
And when was that test done? That was done in 1929.
Yes. And
okay, well, let's follow up on that. In 1929, they tested this on 27 people that were dying of meningitis. All of those people died of meningitis, and so they said there was no correlation between their death and the mercury in the vaccines. That is the only test that's ever been done on thimerosal that I know of. Can you think of any other?
No, in people, no.
Okay,
except for accidental exposures, overexposure.
Okay, so we have mercury that's being put into people's bodies in the form of this preservative, and has been since the 30s, and it's never been tested by our health agencies. And yet, you folks come here and you testify that there's no conclusive evidence, and the IOM says they favor, get this, they don't say they're sure, they say they favor rejection of a causal relationship between mercury and autism and other neurological disorders. Mr. Egan, can you say to me right now that that amount of mercury being injected into a baby will not hurt it?
It's impossible to make those categorical statements of 100%.
That's right. That's what I wanted to say.
Scientific endeavor.
So it is possible that the amount of mercury that's being injected, even in trace amounts, could damage a child neurologically, right?
I don't think it has that capacity. No. I mean, that's, you know, we can argue.
I know, but you don't think it is, but you can't say categorically, can you?
Do I have evidence for every single child, for every possible dose? The answer is no.
Show them the thimerosal bottle, which we keep in a metal container because we're a little afraid of it, and it's a very fine powder.
This is thimerosal, which is labeled very toxic. Has cumulative effects, can cause damage to the kidneys, to the respiratory system, skin, to the nervous system. It specifically warns on here that it can cause reproductive and developmental toxicity, meaning that it can cause things like autism and other neurodevelopmental disorders. This is immensely toxic stuff.
And it's a vaccine.
And this is what's in the vaccine. It's important to realize we're talking about a whole range of products. Vaccines are a big one because, of course, you're directly injecting it. For example, this is tetanus vaccine. This one expires, it's a little outdated now, in 2007. And here's the thimerosal. 1 to 10,000 is a preservative. Perhaps the biggest one in the U.S., at least, that's for exposure to mercury is the influenza vaccine. Influenza vaccine is now recommended for all pregnant women, all infants, all children on a yearly basis. You're supposed to
have last year's influenza? Understand that thimerosal is not added at the end. It's not like, well, that factory next year can make thimerosal free. Thimerosal, you either have to have a thimerosal free factory or you have to not have one. They add thimerosal at each step because the factory is not clean and not sterile. So you either have to have an expensive sterile factory where you don't need thimerosal, or you have to have one that produces thimerosal. It's going to need thimerosal or something the whole time. It needs to be stopped.
This is the influenza vaccine from Adventist Pasteur, their flu zone. Thimerosal, 25 micrograms of mercury per dose.
But I'd like to point out that a lot of people didn't know, and I'm one of them. I've given 2,000 RhoGAM shots. I've been in vaccines for 35 years. I didn't know that RhoGAM had thimerosal in it. So I think a lot of the doctors were unaware. They were unaware that even the word thimerosal meant mercury.
Well, interestingly, I wrote a letter to ACOG, the American Academy of Obstetricians and Gynecologists, stating, you know, I understand you recommend the flu shot. Could you at least recommend the single-dose vial? It's mercury-free. They wrote me back and said, we believe thimerosal to be safe. I said, okay. Here is a picture of the bottle. It's got a skull and crossbones on it. And here's the MSDS sheet, which is a material safety data sheet by the company that says it's a mutagen for mammalian somatic cells. So in layman terms, it causes mutations. So it causes mutations at the level of dividing germ cells, like an embryo. Hello? I said, what about this doesn't bother you? Well, we don't believe. I said, so do your scientists have data that the manufacturer of thimerosal doesn't have? Because here's a skull and crossbones and here's their MSDS sheet. And they were like, thank you, have a good day.
Dr. Bark mentioned that the MSDS, the material safety data sheet for the flu vaccine, shows that it is a mutagen. In other words, it changes DNA. Did you know that most vaccines, including the flu vaccine, Flulival, have never been tested for mutagenicity or carcinogenicity? This means that they have not tested to see if they change or mutate DNA or if they cause cancer. When somebody says mercury, we immediately think of the news stories about a kid at school that broke a thermometer in biology class and the hazmat team is called in and all the students are scared to death. I remember this happened to me when I was in elementary school in Garland, Texas back in the 1970s. I think I was about 7 years old. In the previous episode, we learned from experts about vaccines that still contain trace amounts of thimerosal, which is 50% ethyl mercury. Are there still vaccines that contain more than merely trace amounts of thimerosal? wasn't thimerosal removed from the vaccines in 2003? That's what I've read.
Yeah, thimerosal was removed from 3 childhood vaccines in 2003, but the same year CDC mandated flu vaccines for pregnant women and for little children. Okay. And the flu vaccines at that time, almost all of them contained megadoses of thimerosal. So children who were receiving vaccines after 2003 could get as much thimerosal as children prior to 2003, prior to the removal in 2003 from those other 3 vaccines. And for the first time, they began giving it to pregnant women. So children were getting thimerosal at a much more vulnerable period of their lives. So it's kind of a myth to say that thimerosal was removed from vaccines. It was removed from some vaccines, but it was added to others.
They put it into multi-dose vials because if you have to put 10 needles into the same vial, it's cheaper to produce, once you produce the vaccine, it's cheaper to put 10 doses into one vial than it is to put 1 dose into one vial. And when they do that, they put the mercury in it as an antimicrobial agent because
preserve it.
Yeah, you're putting 10 needles in it. So it saves about 15 cents per dose.
Multiply that out times billions of doses.
Yeah, they're saving lots of money. But if you think about it another way, do you think your child is worth 15 cents?
Yeah.
If the difference is between getting toxic mercury and not getting toxic mercury and it's 15 cents, that's the difference?
When I interviewed Neil Miller and he asked this question about whether a parent would purchase a vaccine with mercury in it in order to save 15 cents, I thought that was a rhetorical question and that nobody in their right mind would do that. However, I recently visited Washington, D.C., and Robert F. Kennedy Jr. and his team, we met with several congressmen and congresswomen to discuss this very topic, specifically the multi-dose flu vaccine, which still contains thimerosal, or mercury. We had an incredible meeting with Congressman Posey and his entire team. I'm not at liberty to mention his name, but we also met with a congressman who told us that since he always pinches pennies, that he would opt for a cheaper vaccine with mercury in it if it saved him some money. Let's figure out exactly how much thimerosal is in the multi-dose flu vaccine. The multi-dose flu vaccine has 25 micrograms of thimerosal. The shot is 0.5 milliliters, so let's do some math. So 25 micrograms in a 0.5 milliliter shot, same thing as 25 micrograms in a 0.0005 liter shot, or 250,000 micrograms in 5 liters, or 50,000 micrograms per liter. Well, 1 microgram per liter is the same thing as 1 part per billion, therefore the shot has 50,000 parts per billion of thimerosal. Now remember that 2 parts per billion of mercury is the mandated limit in drinking water, and normally 200 parts per billion would label something as a toxic hazard. So the multi-dose flu shot has 250 times the allowable limit of mercury in a toxic hazard.
In some states, if a doctor takes that multi-dose vial and drops it by mistake on the floor and it breaks, he is required by law to evacuate the building and to bring in hazmat crews to clean it up before the building can be reoccupied. Hazmat crews wearing moon suits and respirators. So, and we're taking that same toxin, and flu vaccines have to be treated as a hazardous waste if you're going to dispose of them. That thimerosal vial is legally a hazardous waste. It can't be disposed of in a garbage can. Yeah, we're taking that and we're injecting it into pregnant women and little babies. And if it's early in the pregnancy, which is recommended under the current advisories, a little baby could be getting as much as 1 million times what EPA says is safe. (1989) is the year that this epidemic of childhood illnesses began. Autism, ASD, ADD, ADHD, speech delay, language delay, tics, something called misery disorder, which I've never heard of before. Tics is Tourette's syndrome and a family of grave neurological injuries that became epidemic that year. SIDS, narcolepsy, seizure disorders, things that, and of course food allergies and asthma. And all of those things began in 1989. On all of those illnesses, there's science today, there's science out there that indicates that those illnesses are being caused by thimerosal or adjuvants like aluminum or squalene or some other vaccine association.
Something is happening to the brains of our children. Something is interfering with the normal neurosequencing of brain development. Because when babies are born, their brain is not developed. When babies are born, they have more nerve cells than their brains need. And it's through life experience that the tracks are laid down to create the proper sequencing of muscular development, speech development, cognitive development, and emotional development. Something is interfering with the proper sequence of those steps. Something is getting in the way of the brain developing properly. No one is asking the question, why? Why are so many kids having an interference of the proper sequencing of brain development? Why, as of January 2016, are we seeing 1 out of every 20 children under the age of 5 with a seizure disorder?
אז באמת זה הניצחון של קנדי, והנה תוכנית החיסונים. תראו מה קרה, מ-1983 2018. מ-2018 התוכנית לא השתנתה. תראו מה קרה פה. פעם 17 חיסונים, מקסימום 4 פתוגנים שונים ביום אחד, חיסון ראשון בגיל חודשיים. היום מתחילים לחסן בהיריון. מתחילים לחסן בהיריון, ואפילו לא ספרתי פה חיסון שפעת בהיריון, גם את זה נותנים. אוקיי, זה 44. שפעת, טטנוס, דיפתריה, פוליו, זה נותנים בהיריון כבר. ביום הלידה נותנים חיסון למחלת מין, לצהבת בי. אף אחד יגידו לכם, לא, זה מחלת כבד. כן, זו מחלה שיכולה לפגוע בכבד, אבל היא מוגדרת כמחלת מין בגלל אופן ההדבקה שלה, היא מוגדרת באתרים של ה-CDC וארגון הבריאות, תחת הקטגוריה של STI, Sexually Transmitted Illness, או Infectious. זה STD, STI, לא משנה, מחלת מין, מחסנים את התינוק ביום הלידה, למה? כי זה יותר נוח להם לחסן את כלל התינוקות מאשר לבדוק אם האמא נשאית או לא נשאית. שזאת הדרך היחידה שבה תינוק יכול להידבק בלידה. ולא בודקים את הדברים האלה, ואין לנו השוואה של התחלואה הכוללת.
A typical 2-month-old baby will be getting as many as 9 vaccines at once. I mean, it may not be 9 injections, but it's 9 vaccines. I mean, can be at once. They can be getting a hepatitis B, diphtheria, pertussis, tetanus, polio, Haemophilus influenza B, pneumococcal, rotavirus, and I might be missing one.
And the things that concerned me the most were that hepatitis B dose for newborns. Back then they weren't pushing vaccines on pregnant women. That's happened since. And the sheer number of vaccines that were being given, for example, at the 2-month visit, we were giving 6 different vaccines, 3 of which had too much aluminum. So you're multiplying huge toxins, adding on top, and it was just clearly not a scientifically justifiable approach when you understand toxicity.
Plus, there haven't been any studies at looking at the synergistic effects of the ingredients. So if you have one metal, what does it do to the body? If you have one metal and another metal, what does that do to the body? If you have one metal and antibiotics, what does that do to the body? And it's already been shown that metal detoxification in the presence of antibiotics is diminished versus metal detoxification without antibiotics. You have metal, antibiotic, then you have microorganism. What is the synergistic effect of that? So none of those amplified studies or the look at the amplification of one ingredient's effect on another have ever been done.
In medical schools across the globe, physicians are taught that the current CDC schedule has been proven to be safe and effective.
In 2013, the Institute of Medicine, National Academy of Sciences, issued a report that said that the current federally recommended child vaccine schedule of 49 doses of 14 vaccines given between day of birth and age 6 has not been adequately studied for safety. And one of the issues was that the vaccines may have been studied separately, but they have not been studied in the combined schedule, including giving 8 to 10 vaccines on one day. So that is something the Institute of Medicine has acknowledged. The federal government disagrees, but I think everybody needs to understand that child vaccine schedule has not been adequately studied for safety.
The mere injection of material into the body is a medical problem, because you will always create an inflammatory response and the body's need to reject that material and attack it. Why do you think we're having so many food allergies? Because there are food proteins in vaccines. Starting from the vitamin K shot that babies are given at birth.
What's in the vitamin K?
Egg phospholipid and castor oil. And all you have to do is do a literature search. Does castor oil cross-react with peanuts and tree nuts? And the answer is yes.
Allergies were unheard of before the invention of the hypodermic.
While the CDC recommends polio, hepatitis B, diphtheria, tetanus, pertussis, rotavirus, Haemophilus influenza type B, and pneumococcal vaccines for 2, 4, and 6-month-old infants, this combination of 8 vaccines administered during a single physician visit was never tested for safety in clinical trials. In addition, the CDC report entitled Mixed Exposures Research Agenda states exactly the opposite and concluded that mixed exposures to chemicals, including pharmaceuticals and stress factors, may produce unexpected, deleterious health effects. In the executive summary, we read this, and this is a quote: "Exposures to mixed stressors can produce health consequences that are additive, synergistic, antagonistic, or can potentiate the response expected from individual component measures."
That could explain why so many parents are watching their kids deteriorate after vaccinations, even though the doctors, the media, and the government say absolutely no connection, even though the science suggests that there is. You cannot find a single study in the literature that addresses whether the injection of aluminum into the body penetrates the brain, whether any vaccine ingredients enter the brain, and whether polysorbate 80 enhances the delivery of any of those ingredients into the brain. And when I could not find those studies, I was concerned, because I'm told, you're told, vaccines are evaluated and very, very distinctly tested for safety. But yet, you cannot find a study that says, does aluminum get into the brain of children? Does aluminum take other vaccine ingredients into the brain that don't belong in the brain? Because when ingredients get across the blood-brain barrier that don't belong in the brain, they cause inflammation. And inflammation is what we see in 1 in 5 children with learning disabilities and 1 in 40 children with autism. And all you have to do is ask the guidance counselors. And if you get honest pediatricians who are telling you what they're seeing in their practice, they're seeing kids one after another with more and more brain disorders.